As a practicing physician for over 30 years, I was seeing more and more of my patients becoming unhealthier and unhappier. And as a medical school professor and researcher, I was able to look at the medical literature and confirm what I was seeing in my practice, that indeed we have a declining health status in our country. I graduated from medical school in 1980. And at that time, less than 15% of patients were obese. Today in my practice, a third of patients, 35%, are obese. And we have an obesity epidemic. And that obesity is leading to high blood pressure, diabetes, cholesterol abnormalities, heart attacks, strokes, degenerative destruction of our joints. And it's leading to increasing surgical procedures, increasing use of prescriptions. And it's actually leading to death and disability. And not only that, in a lot of my patients, I were noticing that they were on more pain medications for chronic pain syndromes. And the literature also confirmed that. The Center for Disease Control announced recently that we have a prescription painkiller epidemic in the United States because we're passing out pain pills like they're candy almost. And not only that, despite the fact that we have all this technology today and we have all these life-saving conveniences and modernization, my patients were unhappy. More of them were coming in, with depressive symptoms. They were coming in stressed out. And all this depression and anxiety and sleep problems often required medications, antidepressants, anti-anxiety drugs, drugs for insomnia. And once again, my role as a medical professor confirmed what was going on. The literature confirmed that more and more patients are on these medications. In fact, that we have an epidemic going on as far as use of these medicines. And what was also alarming was that even though our lives should be so much better because of all the advancements that we've made, more and more people are emotionally distraught, and we're having an increase in suicide rate. And it's not just in adolescents and young adults. The Center for Disease Control announced that we have a 30% increase in suicide in middle-aged people 35 to 64. So all of this was happening in my practice, and actually I was getting frustrated. I was feeling helpless that there was nothing that I could do because, first of all, I only had a small amount of time with each patient. And the other fact was that I was not trained in wellness. In medical school and in residency, I was taught to diagnose and treat disease and give this prescription or do this surgical procedure. I wasn't taught on how to keep people well in the first place. And then, obviously, I didn't have the time. So that's when I decided I wanted to pursue wellness. And that led to Living Well Aware and ultimately my book, Should I Fire My Doctor? Because it became obvious to me that wellness is not to be found in our healthcare provider's office. It's to be found in us leading a healthy life and trying to reduce the number of office visits, prescriptions, hospitalizations, and surgeries that we're eventually going to need. Because it's a fact. All diseases can be prevented or greatly improved with a healthy lifestyle. And I realized that I wanted to be healthier. So I started pursuing the literature on what is healthy by attending conferences and reading books and putting these elements into my own life. And I came up with 11 essential elements that I am actually applying to my life and that I look at every day. And it's totally changed my life and my husband's life. And by conducting conferences on these 11 essential elements, I get to hear from people months later on what's happened to their life when they've started applying these. And that's what Should I Fire My Doctor is all about. It's about a step-by-step process on how all of us can get healthier and happier. And it's for everyone, male, female, overweight, underweight, great shape, totally out of shape. None of us are that perfect version we're capable of being. And the goal of Should I Fire My Doctor is really for us to hire ourselves, for us to look at our own life and to tweak it and slowly get to that next level of health and happiness and get closer to that best version we're capable of being.